Hello, this is Suzanne Kellner-Zinck with Dawning Visions Hypnosis to speak to you about why conventional treatment programs for people with eating disorders do not work. And that's the same for females as it would be for males, although there are not that many for males at all, as any of you who have been dealing with this problem recognize. So here are a few of the problems that I see. Number one, we're dealing with a problem that has both emotional and physical problems involved for the person who is living with them. For the male anorexic or bulimic, the problem is that of wanting to build a beautiful musculature. And with the muscle dysmorphia, they don't even see that their muscles are building. It's like the women who see themselves as still being fat, even though they're merely a skeleton of themselves. So body dysmorphia is a really big deal, but how do you go about getting rid of it? Well, you don't go about getting rid of it by helping people to eat more food or to stop their behaviors. What you do is you understand why these behaviors developed in the first place. In most cases of anorexia, it has to do with neglect of a primary caregiver, because either they had eating disorders themselves, maybe they were depressed, maybe they had drug addictions, these kinds of things. So they were not available to nurture the child as the child needs to be nurtured. On top of that, the anorexic believes that they need to be perfect, because if they aren't perfect, they were going to cause problems in their family. And this is something I heard over and over and over again from my own clients over the many years I've been working with them. So this isn't some fairy tale. It is the truth from the mouths of those who lived this life. So if you feel like you have to be perfect, you have very high standards both for yourself, like standards you cannot reach, and you also feel that the people around you need to be perfect in order to be, well, capable of being your friend because the standards are that high, meaning that they're always hurt, they're always distracted by the fact that their friends didn't give them credit for people pleasing them, meaning going out of their way to do nice things for them because the people that they were doing these things for were never told that's what they were doing. They're supposed to mind read them. Well, that doesn't work either. So people-pleasing behavior is another real big problem because you're not allowing someone to love you for who you are, even with your idiosyncrasies, of which every person on this planet, including myself, have. That is a definite. The next problem that we have with the conventional treatment is that they're only worried about calories in, and calories in is a symptom. They're worried about the patient's not doing self-harm. That is a symptom, and it helps them feel calm. That's why they do it, and it makes them feel alive because they've deadened their emotions because they were hurt so terribly from a very early age. The earlier the age that they were hurt and not taken care of as a young child, the deeper the imprint is in the unconscious mind, which is why, again, if you're not working in the subconscious mind, in the unconscious mind where all this stuff developed, you're not going to be able to help these people to heal. Addictions. This is a compulsive thinking process about self-loathing. Those are the words my clients have used over and over again, anorexics and bulimics both. And as long as they hate themselves, they're not going to find the reason to help themselves. So if we don't help them to fall back in love with themselves, because they didn't come out of their mother's vaginas hating themselves, they're never going to learn how to do that. And then there's never going to be the will or the capacity to truly help themselves heal. Because understand that this is an anxiety disorder as well. There's a lot of obsessive-compulsive behaviors attached to this, like all their behaviors are obsessive-compulsive. And their thoughts are constant in terms of what they need to do in order to get to where they feel they need to go for the purpose of actually having some control over their life. The problem is that they got out of control of their controlling mechanism when they got to the point where they were restraining their food to so little food that their bodies can no longer function. And this actually leads to heart attacks and also getting infections, which they can die of. My older sister's best friend in 1973, she died of pneumonia, secondary to her anorexia, because her body was so weak it couldn't fight it off. She was all of 18 years old, a nursing student at Duke University. How sad is that? that's how I got my interest in this particular subject. And then as I got my clients started finding me, for whatever reason, I got more involved in learning more about it, and they certainly helped me. With bulimia, I find that the reason that it begins is because there's another sibling in the family who has some kind of disability or some kind of need. In one situation, it was that the sibling was really heavy and the parents were working really hard with her, so the other one became bulimic, and unfortunately she added alcohol problems to it as well. She actually was a full-blown alcoholic by the time she came to see me, and she's only 30-something years old. So we need to understand what we're dealing with here, and to understand that we need to go into the subconscious, unconscious mind, and if the unconscious, subconscious mind is holding on so tightly for the control, we have to go to the higher conscious so we can let go of the unconscious mind and do the healing processes there. Teach them about the nutrition that every being on this planet that's alive needs, including plants. So of course it's true for them too, and to help them to understand what they can eat, what they need to eat in order for their body to function normally and naturally. And I can do that with hypnotic technique through just suggestive hypnosis. So there you go. This is an explanation to help you to understand why the conventional treatment structures have about a 5% success rate, and where I have so far a 99% success rate. I had an older woman come to me who just wasn't ready to let it go. Generally, I like to work with people before the age of 25 or 26. I did have great success with my first anorexic client who is 29 years old. And also, when I'm working with anorexics, they need to be at a stable weight. In other words, they need to be healthy with their weight. I am not going to take on the medical complications and the legal liabilities of working with someone who's so underweight that they are going to get infections and die from them. But if I have a client who's at a pretty reasonable weight for their height, we can do the work and I can help them to clear out all the problems in their mind and help them to heal. I facilitate it with my great amount of knowledge, both from the medical world, the psychological world, the psychiatric world, and of course from my clients who are the experts in how they became the way they became and the experts in how to heal them. There are no better people to teach one how to do the healing process. Trust me on this. So, if you're a male and if you're having eating disorders, I am really working hard to reach out to you because I know there's no treatment programs really for you because the Diagnostic Statistical Manual doesn't even believe that you exist. And we know that you do. And we also know that if you do not get the treatment, 1/3 of all males with eating disorders will indeed commit suicide. So this is a very serious situation. I'm not playing around here, all right? So I will tell you also that my program costs $10,000 for up to a year's service. The service ends when you are cleared of the problems, you know that you're no longer going backwards, and that you have a compelling future that you're actually working toward, which is more important than holding on to your eating disorders. That is the way my program works. We get rid of the problems of the past, all the traumas. We live in the present and we create the future the way that you want it. If that sounds like something that's worth investing in, then by all means, connect with me. I'll have all my contact information in the description of the video. And just know that that's the cost. And that cost is like 1/5 of what it would cost for you to have 1 month of treatment in an inpatient treatment program that won't help you in the first place for all the reasons I just laid out for you. It's very reasonable, and because we do it all online and we do it according to your schedule, it's pretty malleable and easy access. I'm not going to be following you around everywhere. You're not going to be doing any of that crap because we're going to get to the reasons why you do, and we're going to stop it in its tracks using hypnosis and neurolinguistic programming techniques, which are a lot quicker, more effective, and work for good. So long as you want it to be gone for good. It's your choice, people, not mine. All right. As always, I thank you for spending your time with me. Till next time, and have yourself a great day. Bye-bye, all.